Yeah, hi everyone. So again, I'm Erin Ackelstead with Mountain Pacific, and I also have Erica Alm here. We work in collaboration with AHA and Department of Health for the FLEX program, specifically kind of targeting MBQIP reporting and providing support for that. But I know that there may be folks on here who are not a critical access hospital, but the information is still relevant regardless if you're a CAH or a PPS. So we're going to be talking a little bit about kind of the nuts and bolts of actually reporting. And Natalie did a great job at the beginning of her presentation, kind of giving an introduction to, the requirements of the actual measures that are getting submitted. And Erica Alm is going to do kind of get into that a little bit as well. And there might be some duplication of the resources, but they're out there and they're great. Yeah, so thanks everyone for sticking around. And as you start reporting these measures, if you need any support, have questions, feel free to reach out to Erica or myself. And now I'm going to turn it over to Erica.
Okay, thanks, Erin. So today I'm going to just talk about the steps you'll take to submit your data for the social drivers of health. Okay. So this measure will be submitted annually, and you can submit it either vendor or direct submission through the Healthcare Quality Information System with your HARP credentials. So every year it'll be due May 15th for the previous calendar year data. And so this year, hospitals are encouraged to report. So April 1st is when it'll open. So like all other structural measures in the past, it'll open up on April 1st, and you'll have them through May 15th to submit the data. And a specific screening tool is not required, just as long as all areas of health-related social needs are there, then that's fine. And I do have a slide that I will go over that has additional resources, that has a link that will take you to some examples of tools that you can use for data collection. So I'm going to go over the rationale for this being part of MBQIP. So economic and social factors known as social drivers of health are known to affect health outcomes and cost. Therefore, the recognition and measurement of health-related social needs and other health disparities of patients can impact patient care and improve health outcomes. This measure is derived from CMS's Innovation Accountable Health Communities model and has been tested in large populations across states. The intent of this measure is to help ensure hospitals are considering and addressing social needs in the care they provide to their community. And there are some exclusions. So patients who opt out of the screening, patients who are themselves unable to complete the screening during their inpatient stay and have no caregiver able to do so on their behalf, and then patients who expire during their inpatient stay. So to start reporting the measure, you'll log into the Hospital Quality Reporting Secure Portal with your HARP credentials. From this dashboard on the navigation menu, to the left, you'll select Data Submissions. And then you'll see structural measures. So you'll choose that, and then you'll click on Launch Data Form. And when you come in there, it'll ask you to choose a fiscal year. So the example that's used here is fiscal year 2025, and that was for calendar year 2023 data. So this was reported from April 1st through May 15th. That was the submission period. So like for this year, it would be, you would choose, once that opens up for April 1st, you would choose fiscal year 2026, and then you would be able to enter your calendar year 2024 data. Once you come to the screen, you'll just click the Start button next to the right of the SDOH 1 and SDOH 2 measures. And when you come in there, you're going to go ahead and enter the SDOH 1 numerator and denominator. And then kind of like what was previously talked about, the numerator being the number of patients admitted to an inpatient hospital stay who are 18 years or older on the date of admission or screened for the 5 HRSNs. And the denominator is the number of patients who are admitted to a hospital inpatient stay who are 18 years or older on the date of admission. Although you may be submitting data for SDOH 2, the numerator for SDOH 1 is utilized for SDOH 2. And then you'll enter SDOH 2 numerators for each of the health-related social needs. You do not need to enter denominators for SDOH 2 as the SDOH 1 numerators will be used. So once you get this data in, you can go to the next screen, and then you'll just hit Submit. And then the screen that will come up will have your numerator and denominator and the rate for each measure. Higher rates indicate better performance, and you can come in and edit this as much as you need to up until that May 15th deadline. And then it is recommended to have confirmation of your submission for your records. So on the screen, you can select Export PDF and it will give you a report. And this measure is going to be publicly reported on Care Compare starting October 2025. It'll reflect the measurement period of January 1st through December 31st, 2024. And so on this additional resources slide, just a couple links that I wanted to point out. The very first one, the how to submit HCHE and SDOH data. This is a quick tutorial. It'll take you to recording that CMS did, and it will take you step by step through, kind of like what I did here in the presentation to help you report your data. And then another one is the CMS Measures Management System Equity Related Screening Tools. That will take you to some examples of data collection tools that you can use. And that's all I have.
Yeah, thanks. And if, as you start to enter this data and you have questions or you come up with, roadblocks, or if you're, you need assistance, again, just feel free to reach out to Erica or myself and we'd be happy to walk you through it.